Hey, good morning. Now we'll be studying now Bacteroides, the last part of the enterics, Bacteroides, Fusobacterium, Pseudomonas, and other non-fermenting bacilli, like your Acinetobacter, Flavobacterium, Moraxella, Achromobactin, and your Alcaligenes. Okay, so let's start. Let's start with Bacteroides. Your Bacteroides is the most clinically significant uh, uh, species. The Bacteroides fragilis, which is the gram-negative anaerobic colonizers of our respiratory, GI, and the genitourinary tract. It is encapsulated, pleomorphic, that produce foul smelling. So this is very important. Now, foul smelling short-chain fatty acids. So it gives a foul smell, and it also develops a broad antibiotic resistance. It does have an endotoxin activity, but it is weak. It causes abscess that tends to be foul smelling. So if you will be able to open abscesses that is foul smelling, it most likely be of contamination there, or there will be growth of your Bacteroides. This organism is associated with surgery and trauma affecting colonic mucosa. And remember, this is the primary cause of your intra-abdominal and pelvic infection and even bacteremia. So how do we prevent your infection with Bacteroides? First, that's why we are giving prophylactic antibiotics before any start of surgery, especially your abdominal surgery. So give prophylactic antibiotics for planned surgical procedures that disrupt the mucosa. There will be if ever there will be formation of abscesses now because of contaminations or infection of the pelvic cavity during a previous pelvic surgery, we reopen it up and do a removal of the necrotic material and drainage of abscesses. Plus, we also give you antibiotics for infection. The antibiotics would include metronidazole, your moflufloxacin, and your beta-lactams, of course, with anaerobic activity. Okay. So now let's proceed to Pseudomonas. Pseudomonas is the most common hospital-acquired infection. It is a gram-negative, oxidase-positive, aerobic rods with 1 to even 3 flagellae. It only needs simple growth requirements. What's the problem with this? It can grow anywhere. It doesn't need complex nutrients, okay? And unlike your Bacillus Bacteroides fragilis, this organism will exude characteristic fruity odor. So it tastes like ripe fruits, and also will give a blue-green pigment because of the phycyanin pigment. What is the pathogenesis involved with your Pseudomonas aeruginosa? First is the presence of pili. It promotes adherence to the respiratory epithelium. Then it also has a capsule that has antiphagocytic property, and this one will promote adherence to the tracheal epithelium. And it also secretes exotoxin, similar to diphtheria toxin. And also your Pseudomonas can form biofilms when there will be sufficient amount of the bacteria that will trigger quorum sensing. And if your Pseudomonas aeruginosa also will have other virulence factor like your endotoxin, it's enzyme S, which prevents phagocytic killing, degradative enzymes that damage host tissues, and also will have antibiotic resistance. Okay. So Pseudomonas aeruginosa is a known common hospital-acquired infection, it gives it is an opportunistic infection, especially those who are hospitalized, immunocompromised, and debilitated individuals, like your stroke victims. Okay? How does it? What are the infections that are associated with your Pseudomonas? First, we can have Pseudomonas UTI. It can come through the presence of indwelling catheters. So those patients with indwelling catheters who are on antimicrobial therapy. Okay? And with this setup, it can now expose the bacteria to the antibiotics, and later on will develop drug resistant strains. Another one would be, aside from your UTI, would be your barn wound infection. Yung barn wound infection, it now will have colonization of the barn wounds, which later on will follow. Is followed by vascular damage, tissue necrosis, and bacteremia. You can also have Pseudomonas ear infection. We call your swimmer's ear. It is an otitis externa. It can be benign, but it is extremely painful. Or the worst type of otitis externa would be your malignant otitis externa. It is a serious infection which is marked by swelling, pain, and a purulent discharge from the external auditory canal. So the growth and invasion of Pseudomonas can later on go inside and produce nerve damage, bacteremia, and even sepsis. Remember, Pseudomonas is a gram-negative infection or organism. It has an endotoxin, and it can cause sepsis. So who are the persons who are at risk? There would be the elderly and diabetic patients. About skin infections, Pseudomonas aeruginosa skin infection can present with vesicular and pustular lesions. They can progress to cellulitis and even abscesses and large subcutaneous infections. So one of the infection that your Pseudomonas aeruginosa produces is called your ecthyma gangrenosum. So your ecthyma gangrenosum is a focal skin lesion with vascular invasion of the organism of your Pseudomonas aeruginosa, which results to hemorrhage and necrosis, leaving a central dark area. Usually, these are the patient at risk will be those with neutropenia. Okay, so patients with low neutrophils or segmenters can have an increased risk of developing your ecthyma gangrenosum. Next would be your folliculitis. It is the infection of the sweat glands of the apocrine sweat glands. So, infection where there are large areas of high concentration of apocrine sweat glands would be your external ear, the areola, and even the nipple. So how is this folliculitis acquired? This is acquired through immersion in contaminated hot tubs, in whirlpool tubs, and even in swimming pools. You better be careful in swimming, because you might be dipping into a highly contaminated bodies of water. Okay, how about pulmonary infections? Yes, Pseudomonas aeruginosa can give pulmonary infection, especially those, of course, those with cystic fibrosis patients. Okay, fortunately, Asians doesn't have a quite a number of your cystic fibrosis. I think it is more of the Caucasians. And whenever they have infection with, in these cases, in the cystic fibrosis patient, they are usually co-infected with Staphylococcus aureus. And also, for pulmonary infections, especially those individuals who are debilitated and those with neutropenia, Your Pseudomonas aeruginosa can be acquired from contaminated respiratory therapy equipment in your nebulizers, okay, in your ventilators, and it can produce diffuse bilateral bronchopneumonia. For keratitis for Pseudomonas will produce a fulminating ulceration of the cornea. It can be secondary to trauma, okay, secondary to trauma, and with the contamination of Pseudomonas aeruginosa can lead to eye-threatening panophthalmitis, can make and result to enucleation or removal of the whole eye if prompt treatment is not started or not been given. Okay. Pseudomonas aeruginosa can also give disseminated infections of the immunocompromised host, especially those who are of those transplant patients. So, with these cases, we will present with hard to treat septicemia and tissue infections. And of course, Pseudomonas aeruginosa can also infect the bones, causing osteomyelitis. But remember, the most common cause of osteomyelitis could be your Staphylococcus aureus. Okay, so how is it acquired? Your Pseudomonas aeruginosa osteomyelitis are most often due to puncture of foot through uh, athletic shoes. Okay, so how is it transmitted? Pseudomonas aeruginosa is quite common. It is ubiquitous. It lives anywhere in the environment, especially in those with moist environment, in respiratory and dialysis equipment, in cut flowers, sinks, and bar soaps. The Pseudomonas aeruginosa is resistant to soap and many disinfectants and many antibiotics are sensitive to drying. Infection usually begins at sites where moisture accumulates. Okay? So how do we treat your infections? Okay, so we treat it with aminoglycoside or your fluoroquinolones with added anti-pseudomonal and beta-lactam antibiotics. And then let's proceed to the uncommon bacteria. So we have some uncommon bacteria, your Moraxella, which are oxidase positive, gram-negative bacilli, coccobacilli or cocci. They are normal flora of the upper respiratory tract and may cause bacteremia, endocarditis, conjunctivitis, and meningitis. Most of them are susceptible to penicillin and other antimicrobial drugs. They often produce lactonase. Your Achromobacter alkaligenes are oxidase positive gram-negative rods, which are part of the human bacterial flora and has been isolated from respirators, nebulizers, and renal dialysis systems. They are occasionally isolated from urine, blood, spinal fluid, and wound abscesses. Next would be your Fusobacterium. These are the bacteria of the mouth and colon. These are gram-negative bacteria, which produces dental abscesses. And they produce butyric acid and convert crayon into propionic acid. They are frequently isolated from mixed bacterial infections caused by normal mucosal flora. And they can also cause osteomyelitis. So the root abscesses of Carus teeth can now progress to infection of the zygoma and the maxilla. Okay, and that's it. This is the see you again next week. Study hard and see you on the next session.